Do you want to learn how to heal a rotator cuff injury without surgery? Maybe you've been diagnosed with a rotator cuff injury, or you've had an MRI showing a rotator cuff injury, or maybe you just have shoulder pain and you've heard everyone talk about rotator cuff injuries and you think that might be what's causing your shoulder pain. Hi, I'm Dr. Dave Candy, and in this video, I'm going to tell you about what can cause a rotator cuff injury, how to know if you have one, how to know if you'll need surgery for your rotator cuff injury, and what you can do to relieve a rotator cuff injury without surgery. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. So first of all, how do you know if you have a rotator cuff injury? Well, if you have shoulder pain and it's a mechanical shoulder pain that it only hurts when you're moving your arm, it doesn't hurt too much if you're not moving your arm, and you don't have any pre-existing neck problems, chances are pretty good that you have some degree of a rotator cuff injury. But rotator cuff injuries can range from just a mild tendonitis to a partial tear or to a full tear. Now, about 20% of the population has a rotator cuff injury at any time, but roughly 60% of those people don't have any pain or any limitations at all. And the good news about that is that even if you have a rotator cuff injury, it doesn't necessarily mean that you're going to need surgery. Now, once you get up to be about 70 years of age, about 70% of people have a rotator cuff injury, and about 70% of those people don't have any pain. So it just goes to show you that having a rotator cuff injury doesn't necessarily mean that you're going to have any pain or that you're going to need a surgery for it. Now, as you start to get up to be 70 years or 50 or 60, the chances of having a cervical radiculopathy, pain that radiates from your neck and goes down into your arm, also starts to increase. So one of the main things you need to find out is your shoulder pain coming from your neck or is your shoulder pain coming from the shoulder itself? Now, if you've had a prior car accident, maybe even sometime in the past, if you've spent a lot of time working at a desk with your head down, or you have some existing neck pain that's been there for a while, chances are really good that you could have some component of your shoulder pain coming from your neck, even if it's not the whole thing. So you definitely want to rule that out, particularly before going into any type of rotator cuff surgery. Now, symptoms of a rotator cuff injury are certainly pain with lifting things, pain with reaching over your head or putting things away in high cabinets, particularly if they're heavier, particularly if you're lifting with your palm down or thumb down as well. You may have trouble reaching behind your back or laying on your side, particularly the sore side at night. Those are some common symptoms of a rotator cuff injury. Now, what can you do to relieve a rotator cuff injury without needing surgery? Well, here's how to tell if you need a surgery for your rotator cuff injury. First of all, if you are a younger person, 20s, 30s, 40s, and you have a large, massive tear that shows on an MRI, and you've tried 3 months or more of conservative rehab, and it hasn't worked for you, those are good indications that you might need a surgery. But a surgery is not a quick fix. The recovery time for a rotator cuff surgery is on the order of 4, 5, 6 months, depending on how large of the tear and what level of activity that you're looking to get back to. So just keep in mind that it's not like driving your car in, getting a new set of tires thrown on, and then you're back out on the field throwing a ball, or you're back at work doing construction or some other form of manual labor. That a rotator cuff surgery is a big deal, and it's a prolonged recovery process. And if you do ultimately need one, we'd be happy to help you out with that rehab and recovery after the surgery. But again, chances are really good that if you have a smaller tear, or maybe you're getting up there in age in the 60s, 70s, 80s, and you're not that active, you're not going to be throwing a ball anytime soon, chances are really good that you can recover without surgery. The recovery rates for rotator cuff injuries without surgery range in the 50 to 90% range. And 50% sounds kind of small, but it depends on the size of the tear and the specific study that you're looking at. But when you compare that to recovery rates with surgery, very tiny tears have about a 94% success rate. But larger tears are only about 27%. So really your chances of recovering without surgery or with surgery are kind of close. So why would you want to go through the risk of surgery, the risk of anesthesia, the 6 month recovery process if you don't have to? And that's what we want to help you to be able to do. That if you don't need a surgery, to be able to prevent that surgery. The other thing you should know about surgery is about 15 to 20% of people who do have a rotator cuff surgery, they end up re-tearing the shoulder, or re-tearing the rotator cuff. And largely that's because of lack of adherence to activity limitations, that you may expect to be in a sling for up to 2 months where you really can't use your arm at all, and then very limited activity levels for the next several months, so that repair that you've had on the rotator cuff has time to heal. And a lot of people just can't wait that out. They think, I'm feeling pretty good, I don't have pain anymore, I'll start using my arm again. And you really want to avoid that, because that puts you at risk for re-tearing your rotator cuff if you had a surgery. Now, let's move on to the thing that you probably really want to know. How can I get this thing fixed so I don't have that 4 to 6 month recovery period, so I don't have the risk of re-tearing it if I do have a surgery? And some really simple tips to help your rotator cuff if you don't want to have surgery are, number one, again, make sure it's not coming from your neck, or that if there's any piece of it that's coming from your neck, that you get that addressed while you're taking care of the actual rotator cuff injury. Your posture, both in your neck and in your shoulders, it affects the way that your rotator cuff and your shoulder moves. That when you're hunched over like that and your shoulder blades are rounded and your head's forward, it pinches the nerves in your neck that go down to the shoulder. It also rounds out the shoulders and brings the arch of the shoulder down. And when you raise your arm up, if the shoulder blade is hunched over and you don't allow it to raise up, you really can't raise up really far before you start to get a pinch there. Now, if you sit up a little bit taller, automatically you get a lot more range. So just opening up your posture, extending through your thoracic spine, bringing your shoulder blades back a little bit, not military straight, but bringing them back just a little bit, can help open up your range of motion and help you reach up higher. As I mentioned earlier, people with rotator cuff problems often get problems reaching with their thumb down like that, especially when they're reaching overhead. And that's because the shoulder is a ball and socket joint. It's a ball on the shoulder moving in the socket, but that ball is not a perfectly round ball. It's got bumps on it where the tendons attach, and depending on which way you turn your arm, it changes the orientation of that ball within the socket. And when you have your thumb down, it brings one of the bumps right underneath the arch, where you can start to pinch your rotator cuff tendons or your subacromial bursa or some of the other stuff that runs underneath of there. So reaching with thumbs down is no good. Thumbs up is much better. You'll be much more likely to be able to move your shoulder more comfortably if you reach with thumbs up. The other thing is that you have to move your shoulder blades upwards when you're reaching up if you have a shoulder pain or you want to avoid pinching your rotator cuff tendons. And really, you should do that anyway. That's the way that your body's designed to move. That 2/3 of your movement should come from your shoulder joint. The other 1/3 should really come from moving your shoulder blade. So as you're reaching up, think about moving the whole shoulder blade and arm complex up together, not just moving at the shoulder joint alone. Now, for sleeping positions, you want to avoid laying directly on that shoulder. I've actually got some other videos that go over that a little bit more specifically, but if you have shoulder pain when sleeping at night, you want to make sure you have a pillow that supports your neck really well and that you're also not laying right on top of that arm. And I'll link to the other video for more tips on how to sleep comfortably without having shoulder pain the next morning. And finally, if you've been dealing with your shoulder pain for a while and you've tried all these tips, you've gone to your doctor and it hasn't worked, maybe you've had some physical therapy and it hasn't worked, well then give us a call, feel free to reach out, and we'll take a look at your problem, help you find out, number one, is your rotator cuff the cause of your shoulder pain, or is there a component that's coming from your neck? And if it is coming from your shoulder and rotator cuff, what can you do to relieve your shoulder pain so that you don't need a rotator cuff surgery? Now, I hope you found this video helpful, and if you did, give it a like or thumbs up, and subscribe to our channel so you can get notified of our future videos. And again, if you do need some help, just give us a call at More for Life, and we'd be happy to help you out. Thanks for listening, and have a great day.